You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mother of four, and a teratogen information specialist. So that means that I talk to people about exposures before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a prescription medication, it could be a chemical at your work, a vaccine, or a lot of other things. And we at Mother to Baby talk about all of those things and more. And at the time of this recording, it's January. And as part of Birth Defects Awareness Month, we have a very special guest. Dr. Shannon M. Clark is double board certified in obstetrics and gynecology and maternal fetal medicine at the University of Texas Medical Branch in Galveston, Texas. She is a maternal fetal medicine specialist and the mother of twins. Dr. Clark, thank you so much for being on the show today.
Thank you so much for inviting me. This is going to be fun. I can already tell.
Yes, I absolutely agree. First of all, how are your twins doing?
Well, my son's a little under the weather, but they are 6. I do have boy-girl twins, and they're doing very well. They think they're 16, but most 6-year-olds do. But other than that, they're in kindergarten, and they're tearing it up in kindergarten.
Nice. Okay, so let's jump right in. So first and foremost for our listeners, what exactly is a maternal fetal medicine specialist, and what are some reasons that people would need to see one?
Okay, so medical school. We go through 4 years of medical school. And then as medical students, we decide where we want to spend the rest of our days as a physician. So you could go into any number of residency programs. For me, I went through 4 years of an OBGYN residency program. And then after that, some fields can what we call subspecialize, meaning within the field of obstetrics and gynecology, there are different subspecialty fields, maternal fetal medicine being one of them, which would require an additional 3 years of fellowship training. So that's what I did. So now as a maternal fetal medicine specialist, also known as a perinatologist or a high-risk pregnancy specialist, all of my patients are pregnant and they have some form of complication in their pregnancy, whether it be related to maternal medical disease or something with the fetus, whether that be a birth defect or growth abnormalities, or something with the placenta, a placental abnormality. A more common one is like a placenta accreta or previa. So that's what my day-to-day is seeing patients, also doing ultrasounds on pregnant individuals and their fetuses to follow their pregnancies for whatever complication they may have. But what are some of the reasons why you might see, and we're going to refer to MFM, refer to it as MFM or maternal fetal medicine specialist. So what are some reasons to see an MFM? One of the reasons to see an MFM that's actually not utilized enough, in my opinion, is preconceptionally, before you even get pregnant. So say you had a complication in your previous pregnancy that you're worried may affect either the management of your pregnancy or the delivery of your next pregnancy. You might want to go see someone like myself to get some advice or recommendations on how to manage the next pregnancy before you even get pregnant. A lot of times people that have hypertension, diabetes, other things, medical complications or chronic medical conditions, as we refer to them, might want to see someone like myself to get some advice on how to get those conditions optimally controlled before they get pregnant. Then obviously people come to see me when they're pregnant. So there's any number of reasons to see an MFM during pregnancy. Like I mentioned some of the other ones before, like diabetes, high blood pressure, autoimmune diseases like lupus, kidney disease, cardiac disease, whether it be a congenital heart defect or acquired heart disease, anything that could be considered a chronic medical condition or a medical condition that the pregnant individual has that could impact the management and course of the pregnancy. Then we think about the fetus, maternal fetal, anything with the fetus, multiple gestation. There is a growth abnormality of the fetus. There's a birth defect that was diagnosed. Anything that could be potentially abnormal with the fetus, having abnormal quad screen, which is very common when you're getting those screening tests for chromosomal defects in pregnancy. And then anything that could be related to postpartum care. Say there's a heart defect or a heart disease that the pregnant individual has where they are at increased risk for postpartum complications. That's another reason to see someone like myself. Surgical emergencies. You have a appendectomy or some kind of surgical emergency that's not necessarily related to the pregnancy, but you happen to be pregnant. So there are a lot of reasons why an MFM, such as myself, might become involved in your care preconceptionally, during the pregnancy, or in the postpartum period.
I'm so glad that you mentioned that you can see patients before they're pregnant. That's exactly what happened to me. So in my third pregnancy, right at the end, I had really high blood pressure. They were pretty concerned. And then when I got pregnant for the fourth time, before actually I got pregnant for the fourth time, I wanted to see someone. So I saw an MFM in my area who did exactly what you described. And it was so helpful to feel like someone knew my situation, someone knew what I wanted my next steps to be. So I had some things in place, and it made me feel a lot better about the process.
Yeah, like I said, it's very highly underutilized. I think a lot of people just really don't know it can even be done. But there are a lot of things we can do in the preconception period to, assess is your diabetes optimally controlled? Is your heart disease optimally controlled? Is your blood pressure? Oh, you know what? We might need to do this before you just, decide to start trying to conceive. Or is there something that happened during your delivery or your pregnancy that would impact the next pregnancy? Reviewing those medical records if you delivered somewhere else and now you're at a new state or institution that's going to be handling your next pregnancy. It's all, we can do the medical record review for you. So there's a lot of things that we can do for you to be proactive, to help you be proactive for your next pregnancy.
I'm so glad you brought that up too, because I would love for you to share with us a few important ways that we can prepare for a healthy pregnancy before pregnancy.
Yeah, so for those that may or may not know me on social media, I do a lot of education on social media. It's one of my passions, and I talk a lot about folic acid. And why do I do that? I never thought in my career of 22 years of practicing high risk or obstetrics in general that I would have to be regularly and routinely talking about the importance of folic acid and during the preconception period and during pregnancy. Folic acid is a form of folate that is found in prenatal vitamin supplementation, as well as just individual supplements that you can find over the counter. And there are numerous forms of folate that you can find in these supplements and prenatal vitamins. Numerous. And some of the more popular ones would be 5-MTHF or methyl tetrahydrofolate, quatropfolic acid, folinic acid, you name it, there's at least 24. But folic acid is the only form of folate that has been proven in randomized controlled trials and other studies to help prevent neural tube defects. Why is that so important? Well, the neural tube closes very early in pregnancy, about 5 to 6 weeks of gestation. So that means you need to have that folic acid on board and in your system, ideally 1 to 3 months prior to conceiving and at least through the first trimester of your pregnancy in order to help mitigate that risk of neural tube defects. We do know that reproductive age individuals do not consume enough dietary folate, which is the best way to get your folate, but we just don't eat enough to get enough dietary folate in our diet alone to help mitigate that risk for neural tube defects. So that's why folic acid, 400 micrograms daily, starting 1 to 3 months prior to conception, and then throughout the first trimester, is recommended by numerous medical organizations for the prevention of neural tube defects. There's also some evidence that it might help other forms of neural defects like cleft lip and palate is one. But the evidence is strongest for neural tube defect prevention. And that's important because it can cause spina bifida, which is not always lethal, but anencephaly is lethal. And that's something that we want to try to prevent if we can. And the best preventative measure that we have right now is to take that folic acid. So that's the first thing I would say. Make sure you're taking, if you're a reproductive age individual and you could potentially become pregnant, please take some kind of supplement, prenatal vitamin even, with folic acid in it. The next thing I would say is to, not only to become pregnant, but also for your future fertility. Be mindful of any kind of sexually transmitted infections because, sometimes they're not diagnosed in a timely fashion and they could potentially affect future fertility and a pregnancy should you get pregnant. And then if you're on any medications for any reason, again, this is another good reason to see an MFM in a preconception consult. If you're on medications for a chronic condition, whether that be diabetes, high blood pressure, lupus, kidney disease, headaches, seizures is another common medical condition that people are on medications for, see someone about those medications to make sure you're, number one, optimally controlled, and number two, that they're okay in pregnancy. Sometimes you might need to switch the medication up in anticipation for pregnancy to a more favorable medication. And sometimes you might change the dosage a little bit or the combination of meds that you're on. So if we can do that prior to conception, that's ideal. If not, if you happen to become pregnant unexpectedly, just see someone sooner than later to make sure whatever medications you're on are okay. And another class of medications are anything to treat any kind of mental health disorder. That's another classification of medications it's important to review with someone should you become pregnant. Being up to date on vaccinations. Can't tell you how important that is. Maybe we could discuss that in more detail in another podcast, but vaccinations and pregnancy, getting up to date on your vaccinations are crucial for pregnancy. And then the last thing, just making sure, like I said, anything that you have that's considered a chronic medical condition, just make sure that it's optimally controlled in the event that you do become pregnant. Because yes, we can play catch up if you get pregnant if you're not optimally controlled, but that's not ideal. So we would prefer that happens before conception, if at all possible, so that we don't have to play as much catch up when the pregnancy does occur. So those are probably the biggest things I would say that you could do, other than avoiding smoking and alcohol, and also knowing your family history. Those are the biggest things I would say that you could do in anticipation for pregnancy.
And thinking about birth defects in particular, as this is Birth Defects Awareness Month, what are some common questions that you get about birth defects in pregnancy?
So the questions that I mostly get are after I've diagnosed something. Because, I as part of my job, routinely, I am doing fetal ultrasounds at any time during the pregnancy, whether it be right, in the first trimester, all the way up to right before delivery. So if we do pick up something, the first question I get is, why did this happen? And there's sometimes where we can give an answer as to why it possibly happened. Of course, we're looking at a fetus that's inside the uterus, and we can't always give you a definitive answer. But I also think people ask that because, whenever a fetus has some kind of defect, there's always some form of, did I do something wrong? Is there something I could have done to prevent this from happening? And majority of the time, the answer is no. Birth defects do happen, even in the most well-managed pregnancies and in those individuals who feel like they try to do everything right. Unfortunately, birth defects do happen. So, going through that with the patient is very important to understand that by and large, there's not a whole lot that people can do for a lot of these birth defects that we do diagnose. And then the second thing they would probably ask is, okay, so my baby has this condition, or the fetus has this condition. So what does that mean? Is there anything that can be done to change it? Or how's it going to affect the remainder of my pregnancy? Well, I have to deliver early. Do I need to deliver at a different institution? And, those are all great questions that have to be asked and answered in anticipation for managing the rest of the pregnancy and then also delivery, because there are some birth defects that would need to be delivered at a center with a certain expertise in the NICU, maybe certain expertise as far as pediatric surgery goes. So it all depends on what the birth defect is. So planning for that is crucial. And then, do I need to do anything differently from here on out? Is the management of my pregnancy going to change? For sometimes you might need to get more frequent ultrasounds or other types of what we call antepartum fetal testing or surveillance throughout the course of your pregnancy, depending on what we find. So those are all questions that need to be addressed with the patient. And that hopefully a good MFM is going to sit down and go through all of that with you. And, the possible what ifs and things that might change throughout the course of your pregnancy.
And what are your top 3 tips for a healthy pregnancy?
This is probably not what you're expecting to hear, but I would say be very, very careful about getting anything off social media. Even as someone who educates on social media, I would still say that. And that's because there's a lot of inaccurate information. And a lot of accounts that don't necessarily provide accurate information, and what they end up doing is instilling more fear. And that includes certain groups, what we call Facebook groups or other types of social media groups that where information can be shared by non-medical or non-credentialed individuals in pregnancy care. So please just be mindful of that, because a lot of times I see patients get so stressed out and so worried that something is not being done, or they need to do something different, or they need to take this, or they need to take that, because they saw some kind of social media post telling them that's what they need to do, or that this thing that's happening in their pregnancy, or this birth defect the fetus might have, happened because I didn't do this. This is what I saw on social media. I hear that all the time. So just be very careful, especially for your mental well-being, about what information you consume regarding pregnancy, especially your pregnancy, from social media. I think the next thing is, find a obstetrical care provider that you trust. That is first and foremost. You got to find somebody that you really trust to give you the best information and accurate information for your pregnancy. That should be your go-to person always. So if it's somebody that you just don't trust, that can be problematic. And you might want to decide sooner than later that you might need to find a different obstetrical care provider. You really need to make sure that you have that kind of relationship with your provider. Now, the last thing I would say is have an advocate. Have someone that can go to appointments with you, or someone that, and I do this all the time, if a patient comes by themselves and I find something that, is not expected, I say, who do you want to call? I can listen in on this conversation that you trust to hear this information with you, so that they have another set of ears hearing this information that they may find difficult to digest at that time, but the second person is listening in that could be their advocate and also ask questions. So those are all key to having a healthy pregnancy, I feel. I know there's certain things we could say, of course, avoid alcohol, don't smoke, and things like that. But these are some of the things that aren't talked about as much. And I think they're just as important to having a healthy pregnancy.
I agree. And I'm really glad you brought those up. You're right. Absolutely right. I did limit you to 3. However, I was wondering if there was a final message that you wanted to leave our audience with.
So, I would say, and having gone through a very complicated pregnancy myself, there's a lot of things that can happen that are unpredictable. And you may have been labeled, you have a high-risk pregnancy. And you have to see an MFM like myself, and it can be so scary and so intimidating. But and we think especially about those individuals who are over age 35 and over age 40. We know the average age of first-time pregnant individuals is increasing. We know that more and more individuals over age 35 and even over age 40 are having babies, which comes along with its own additional, list of risks to consider in pregnancy. And it can be very daunting and scary. But I always say this, and I did not come up with this phrase, but I heard it somewhere, and I wish I remembered where it was, but it's so good. Just because your pregnancy is high risk does not mean your risk is high. So there are still things that you can do, even if you're labeled as a high-risk pregnancy for whatever reason, where you could still have a healthy pregnancy and you could still have a good outcome. So please just try not to get too intimidated by anything that happens in your pregnancy. Just make sure you trust your healthcare team and that you ask all the questions you need to ask and make sure you get those answers.
Excellent. Dr. Clark, thank you again so much for being with us today. And actually, you kind of offered earlier to be a guest on a future episode, so I'm going to take you up on that.
I would be happy to do so. Thank you.
And Dr. Clark, how can our audience members find you online?
So I'm probably most active on Instagram at Babies After 35. I have tons of highlight reels with tons of evidence-based information and resources and articles. It's probably where I'm the most active, but you can also find me for some of the more fun stuff on TikTok at TikTokBabyDoc.
Great. I don't know why, but that sounds very satisfying. TikTok Baby Doc. Thank you again. And thank you to our audience for being part of another episode of the podcast. Remember that you can always find us on iTunes, Spotify, or however you listen to podcasts. If you have an idea for the show, or if you want to be on the show, we want to hear from you. So please feel free to email us at contactus@mothertobaby.org. And if you're looking for information about exposures before or during pregnancy, or during breastfeeding, or you're thinking about adopting, don't forget about mother to baby. So you can give us a call and speak to one of our teratogen information specialists at 866-626-6847. You can text us at 855-999-3525. You can find us on our website at mothertobaby.org. There, you can chat with a specialist, or you can email us also. We have fact sheets, we have baby blogs, we have episodes of the podcast, and so much more. So, until next time, remember, Mother to Baby is here for you. Take care and Happy New Year.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.